with the doctor within 3 hours of having my colonoscopy, and the diagnosis and the program was laid out for me.
The rectal cancer diagnosis is a very difficult diagnosis for patients, as it involves a lot of complicated steps.
I have said that the system swept me off my feet. The appointments just came in, so I had appointments to see the people about radiation treatment, the oncologist, and I had appointments with the surgeon. In each of these meetings, we had discussions about what the various stages in the process really meant. In my case, it seemed that the path was very clear, but there was an opportunity to have a discussion about options.
Once you come down to the Department of Radiation Oncology and Department of Medical Oncology for your chemo and radiation treatment, we have a pretty extensive education program.
As a radiation therapy patient educator, I focus on educating our patients, providing them with all the resources, not only of the Tom Baker, but also of the radiation therapy department. We've developed, in conjunction with the Cross Cancer Institute, all the side effects pamphlets that the radiation oncologists have seen and approved, and we give those out to all of our patients, and we go through them. I sit down with them, go through a PowerPoint presentation with them, and make sure that they're well educated about everything that's going to happen to them in the room.
There was an appointment prior to having the radiation treatments.
Patients have to have a simulation appointment. During that appointment, we will do a CT scan of their pelvis, where we look at your tumor and your body, and we will handcraft the radiation treatment to shape it to exactly around your tumor and the areas that we need to treat.
The patients want to know exactly what's happening to them, and they find that there's a lot of information out there.
If I have a question, I'm going to ask a doctor. I depended on them to give me the information when I had the questions, and I got the information.
So when we give the patient education, the information, we want to make sure that we go through that with the patient so that they understand all the information, so that they're also relaxed, they're not anxious, they're going to walk into the room and know exactly what's going to happen in the treatment process, and they're going to know how the treatment works, how that relates to their side effects, and how to look after themselves when they do have side effects.
I had a conversation with the oncologist where he talked about the chemotherapy. My doctor explained to me that the appropriate kind of chemotherapy for my treatment was pills. He said there may be reactions and everybody's different.
We try to personalize their treatments specifically for their needs, their medical conditions, and the details of their cancer.
You will have 6 weeks of chemotherapy and radiation treatments, followed by 2 months of recovery, followed by surgery to remove the tumor, followed by recovery, followed by 4 more months of chemotherapy. And that process will take 10 to 12 months.
Cancer is a pretty scary diagnosis.
Okay, this is what I have to do. There's a beginning, there's a middle, and there's an end.